Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas. Today in Foundation Modules Lecture 5 we are going to discuss with the ovarian and the menstrual cycles. So ovarian cycle consists of basically two phases. The one is follicular phase and other is the luteal phase. So in follicular phase there is the growth of the primordial follicle, then it becoming to primary follicle and secondary follicles and developing into the Graphian follicle. And in second phase, that is the luteal phase, the corpus luteum is formed, which is responsible for secretion of the hormones. So at a time of ovulation, at the mid-cycle, ovulation takes place, which is a release of ova from the ovaries. So what happens in follicular phase? The development of the follicle is characterized by growth and differentiation of the primary oocyte. So this is the primary oocyte. Then proliferation of the follicular cells, which is formation of the zona pellucida and development of the theca folliculi. So in this diagram you can understand this is basically a diagram from forming the hypothalamic pituitary ovarian uterine axis. So all the mechanism showing that initially there is a secretion of the gonadotrophin releasing hormone from the hypothalamus, which act on the anterior pituitary gland to release FSH. This FSH affects this FSH recruits primary follicles in the ovaries, 4 to 5 primary follicles in each ovaries to become the secondary and the Graphian follicles. So under the effect of this FSH hormone, initially there is an increase in the size of the follicle. There is a stratification of the cells forming the granulosa cells surrounding connective tissue. Around it becomes the theca, and this theca then organized itself into two layers. The inner layer is the theca interna, which is more vascular and cellular, and outer layer is the theca externa, which is connective tissue layer. In addition to this, zona pellucida is also secreted, and this zona pellucida is a protein rich material which covers the oocyte, and at the same time stratification of the granulosa cells occur, and after the stratification the crescent shaped cavities begins to appear, and when these cavities enlarges, the oocyte become the cell, the structure become the Graphian or mature or vesicular follicles. So in this follicular phase, the granulosa cell and the theca interna cells secretes hormone. Theca interna basically secretes androstenedione, and this androstenedione is converted by the granulosa cell into estrone and 5-estradiol. And this 5-estradiol, both are estrogen, which affects the uterine endometrium to enter into the proliferative phase, in which the proliferation of the endometrium takes place. So this is the whole story of the follicular phase. Then at the mid-cycle there is a surge of LH hormone, which causes the release of the ova from the Graphian follicle. The process is called the ovulation. So this is the histological diagram. You can see these are the large number of the primordial follicles which are present in the ovarian cortex, and this is a diagram of the developing secondary follicles with the, in which you can see this is the oocyte surrounding granulosa cells, and the zona pellucida is present, and this is crescent shaped cavity, and this whole is the theca interna, which is present over here, which is derived from the connective tissue. So this is the graphical presentation of the different hormones in different phases of the ovarian cycle. So in this first you can see there is the secretion of the FSH hormone from the anterior pituitary gland in first half of the cycle, that is the follicular phase, and under the effect of this FSH, LH starts to secrete, and at the mid cycle there is a surge surge of LH hormone, and this surge of LH hormone affects the developing follicle and causes the ovulation. And after this, remaining structure, which is corpus albicans, starts secreting both estrogen as well as the progesterone. And these hormones then, at the same time, the endometrium shows changes. It enters into luteal phase, also called the progestational phase, also called the secretory phase. During this phase, under effect of progesterone, there are secretory changes in endometrium, and endometrium proliferate, and it's become secretory in nature. And after this, if pregnancy does not occur, there is a decline of hormone, and also the corpus luteum degenerate and results in ischemia and necrosis, and the menstruation starts. So this is the endocrine control. Hypothalamus basically secreting gonadotropin releasing hormone, which affects on the anterior part of the pituitary. This anterior pituitary then releases follicle stimulating hormone, which recruits follicles from the ovaries, and ovarian follicle starts to develop. This ovarian follicle then starts secreting estrogen hormone, which again have a negative feedback on FSH, but it also has a positive effect on GnRH. In the time of the mid-cycle, there is a surge in LH hormone, which causes the ovulation, and under effect of this, both the estrogen and progesterone are secreted from the corpus luteum. These estrogen and progesterone have a negative feedback effect on GnRH, and because of this negative feedback effect, the anterior pituitary stops secreting FSH and LH, which leads to the degeneration of the corpus luteum. Corpus luteum degenerates, and there is a drop of all of the hormones, which will lead to menstruation. So in ovulatory phase, first the oocytes, the Graafian follicle enlarges inside, and it produces a stigma. This is an avascular spot on the surface of the ovary, and under the effect of different hormone, collagenase activity increases in the surface of the ovary, and when there is a surge of LH hormone, under the effect of LH hormone surge, there is a increase in collagenase activity. Also, there is increase in the level of the prostaglandins. These prostaglandin causes localized muscular contraction in the wall of the ovary, as a result of which the oocyte is extruded from the Graafian follicle. Also important at this point is that under the effect of the LH hormone, there is resumption of the first meiotic division, and secondary oocyte is formed, and secondary oocyte starts its second meiotic division nearly 3 to 4 hours before the ovulation takes place, but its second meiotic division is again arrested at metaphase, and it will only be completed if fertilization occur. Also important point is that the remaining structure which is left over here, it will form the corpus luteum. The corpus luteum, the cells accumulate, they become secretory in nature, and then they starts to secrete progesterone in addition to the estrogen as well. Also important at this point is that as the oocyte, secondary oocyte is extruded from the ovaries, surrounding cumulus oophorus cells then also organize themselves around the secondary oocyte, and they form the corona radiata. So what is the fate of the corpus luteum if pregnancy does not occur? So corpus luteum involutes and degenerates 10 to 12 days after the ovulation. It is called corpus luteum of menstruation. Then it becomes corpus albicans. There is a fibrosis and degeneration of the luteal cells, and after that corpus atreticum is formed. And all this happens because there is a withdrawal of the estrogen and progesterone, both having negative feedback effect on GnRH, and GnRH then have negative feedback effect on the FSH and LH, which stops secreting by the anterior part of the pituitary. Because of this, the corpus luteum involute and degenerates. So again, this diagram shows that the progesterone estrogen negative feedback effect on GnRH secretion of GnRH reduces from hypothalamus. As a result, there is no stimulus for the FSH and LH. So LH and FSH also decreases and results in degeneration of the corpus luteum. So LH hormone maintains the corpus luteum. Progesterone estrogen from corpus luteum inhibit GnRH, slowing the release of FSH, and without LH the corpus luteum degenerates, which will lead to then start of the menstruation. So this corpus luteum then grows to diameter of nearly 5 centimeter, and it continues to secrete the progesterone hormone. Next important is to understand is the menstrual cycle. So you must understand there are two types of the cycle. One is the ovarian cycle and other is the menstrual cycle. So in ovarian cycle we have studied two phases. One is the proliferative phase and other is the luteal phase. At the same time there are changes in the endometrium of the uterus and it shows the menstrual cycle. So first half of the menstrual cycle is the proliferative phase, and in this proliferative phase, under the effect of the estrogen hormone, there is proliferation and development of the endometrium. Endometrium regenerates itself, its glands starts to develop, and it's start to form the it shows these changes in its endometrium. There is a fluid, there is development of the blood vessels as well. So when at the time of the mid cycle, when ovulation occurs, there is a release of the LH, and there is surge of the LH hormone, and under effect of this LH hormone, when ovulation takes place and corpus luteum starts to secrete progesterone, and this progesterone then affects the endometrium, and endometrium enters into the secretory phase. So during this secretory phase, multiple changes occur. There is maximum growth of this endometrium. There is secretory changes. As a result, endometrium is prepared for the implantation of the embryo. Also the spiral artery, which is supplying the endometrium, it shows coiling large blood vessels and the cuneiform in the venous system. There is accumulation of the glycogen in the glands, edema fluids forms, and these all changes prepare the endometrium for the implantation of the zygote at this stage. But if the fertilization does not occur, this progesterone and estrogen then having negative feedback effect and GnRH and GnR, and there is a decline in secretion of FSH, LH, and as a result decline in secretion of estrogen and progesterone, because corpus luteum degenerate, and because of this degeneration of the corpus luteum, there is a withdrawal of the progesterone hormone. As a result of this withdrawal, there is a period of 1 to 2 days of ischemic changes in the endometrium, in which the blood vessels shows period of ischemia, and as a result of ischemia, the endometrium become paler and it starts to slough off, and then the menstrual phase started, which is the third phase of the menstrual cycle. So these are the whole picture of the uterine endometrial axis, in which the hormone from the anterior pituitary affects the and ovaries, and the hormones from the ovaries then affects the uterine endometrium. So next is the oocyte transport. At the time of the ovulation, the fimbria move over the ovary and sweep the ovulatory mass containing the secondary oocyte into the infundibulum. The ovulatory mass is then guided into the ampulla through the movement of cilia and by muscular contraction of the uterine tube wall, that is tubal peristalsis. So it has been estimated that ovulatory mass takes about 25 minutes to reach the site of the fertilization. So this is the diagram in which you can say this is stigma formation, and the fimbriated end starts to cover. Here fimbriated end completely covers the area where the oocyte will be extruded, and here you can see that the oocyte is transported into the infundibular part of the ovarian tube. Sperm transport, usually 200 to 500 million sperms are deposited. Sperm passes by movement of their tails through uterus and tubes, assisted by the muscular contraction. Prostaglandin present in seminal plasma may stimulate uterine motility at time of the intercourse. It is not known how long it takes sperm to reach the site of fertilization, but the time of transport is usually sometimes short, nearly 5 to 45 minutes. So sperm tail motility is vasculacy in seminal secretion form the vaginal plug and prevent the backflow of the semen into the vagina. At ovulation, cervical mucus becomes less viscid and uterine contraction due to prostaglandins in the semen. Acid pH of the vagina decreases the sperm motility. Alkaline pH of the uterus increases the sperm motility. So chemotaxis by the ovum and secondary oocyte moved by the tubal peristalsis. Contents of the semen, the sperm less than 10%, seminal secretion 60%, prostatic secretion 30%, bulbourethral gland 10%, and normal 100 million per ml of the ejaculate, and normal amount of ejaculate is 2 to 3 ml. So less than 50 million total or 200 million per ml of the semen shows the sterility. So conditioning of the sperms occur in the female genital tract, and it is very important before fertilization, and during conditioning two processes take place. One is the capacitation and then is the acrosome reaction, and capacitation starts in uterus and continues into tube. Follicular fluid enhances the process and it takes about 7 hours. The glycoprotein coat and the seminal plasma proteins are removed from the plasma membrane over the acrosome. The capacitated sperms show no morphological changes, but it is more active, and completion of the capacitation permits the acrosomal reaction to take place. So in acrosomal reaction occurs after binding to the zona pellucida. It is induced by the zona proteins. Outer membrane of the acrosome fuses at many places with overlying cell membrane of sperm head. Fused membranes then rupture, producing multiple perforation through which the enzyme the hyaluronidase in the acrosome escapes and oozes out. So acrosomal reaction in hyaluronidase is secreted, which needed to assist in penetration of the corona radiata barrier. Then the trypsin-like substance needed for digestion of zona pellucida. Acrosine also needed to have the sperm across the zona pellucida, and the progesterone present in follicular fluid seems to stimulate the acrosome reaction. So all these reactions takes place because of these enzyme-like substances, and after this acrosome reaction, only the capacitated sperm now can fertilize the ovum. So here I complete my today's class. Next class we will do about the fertilization. These are your references from the Langman Medical Embryology and the Developing Human by the Keith L. Moore and T.V.N. Prasad. Thank you so much for your attention, dear students. Allah Hafiz till the next class.